So how about this Eisenmenger syndrome? We all are remember what is Eisenmenger syndrome. Okay, we'll speak about it sometimes later and all, but uh, so common things at least what we expect is see ASD, VSD, and PDA. We all are aware that they are different entities. However, their presentation can be a bit similar. So what is called as P pulmonale. So P pulmonale will refer to the right atrial enlargement. So the right atrial enlargement can be expected at least in quite a lot of cases of the ASD, but less unlikely in the VSD because everything in the ASD is happening on the upper chambers. So you can expect it more often. Okay. And the VSD, of course, goes to the lower chamber, PDA even further. So that's why the RVH, for example, the RVH will happen most commonly in the ESD, but only in the less oftenly in the VSD, and maybe similar or even a little bit less in the PDA as well. Okay. If you will recall, what are the conditions in which we can expect Q wave in V5 and V6? Can anyone recall for that? So Q waves we expect in the V5 and V6, especially in the volume overload. So what are the conditions in which volume overload we can expect in the PDA and occasionally, of course, in the VSD as well, which we already gave you some of the examples. So one of the important things we all are concerned, how about the severity of the shunt? So for example, it will depend uh, how is the shunting is happening. For example, if so it can be again mild, moderate, or severe. So if you look at the pulmonary flow to the systemic flow ratio, if there is more of pulmonary flow or is it more of systemic flow, and on the basis of that you can again uh, with this ratio you can comment on the size of the shunt as well. Okay, if the ratio is less than 1.4 it will be mild, but if it is more than 2 it will be severe. Similarly, if you notice there's a right atrial enlargement, so you can already notice, so most of the things are going in the right side rather than going to the left side. So of course, if right atrial enlargement, do you notice chances will be it to be more towards the worst side, so it is moderate or severe. Similarly, for the RV volume overload, again it can be moderate or it can be severe, isn't it? And then similarly for the croquetage sign will be, again as I had said, it is what happens is this will be more of the severe sign. And isn't it the reason as well I had said it? What do we notice during the croquetage sign will be the fragmented QRS, especially in the